Interventions, do they really work? Can we force someone to get sober? Coming up next on Toronto Speaks Addiction. Hi, I'm Dr. Vera Tarman, and welcome to Toronto Speaks Addiction. Tonight we're discussing interventions. Can we force someone to get sober? How does an intervention work? Joining me tonight are two addiction counselors who use interventions on a regular basis. Rosemary Munro from Journey to a New Life Counseling and Carolyn Green from Rupert Case Management. They have seen the successes and failures of interventions and are here to give you the inside story. Are you struggling with someone who doesn't want to get clean, wondering if an intervention might do the trick? If you'd like to share your insights or, about interventions or just have questions about how to stage one, please give us a call. So I'm going to ask, I'll start with you. Can you tell me, what is an intervention? How is it different from, I don't know, just a general assessment or something else? What is it?
Well, generally it's an attempt by family members, sometimes friends, possibly employers, to bring to the consciousness the adverse consequences that a substance user might be presenting and not see. And to better help them make their decision about whether or not they want change or help.
Do you want to add something to that, Rosemary?
Yeah, I'd like to add to that. That the intervention is really twofold in purpose. Of course, the family want to get the person into treatment, but the intervention is as much for the family members and friends or whoever's involved as it is for the addict, because they need to learn and understand their role and how they keep the system going.
Okay, but what does an intervention actually look like? Like, is it just me getting somebody to sit down and like force them to sit down and say, this is the trouble you've caused me? Like, what does it actually look like?
Well, you know, the typical type of formal intervention you see on TV, you know, would be a team of people, a cohesive team that's going to be involved. Or there are softer types of intervention. Sometimes it's not appropriate to have, you know, 6 or 7 people in the room. Sometimes it might be just 2 or 3 people in the intervention. It's so, you know, there are different ways of intervening.
Okay. Did you want to add something to that, Carolyn?
Sure, and to add on to what Rosemary said, it's also for the family members so that they can feel that they've done everything that they could do in the event that things don't work out well. So they get information about their part in it and information about how to proceed.
How is it different than like a family meeting? Like, let's say you have a family that comes to meet and you do a therapy session. How is it different than that?
Well, it's structured. At Rupert Case Management, we always do a pre-intervention, and usually there's several meetings, so there'll be some form of individual meeting with the first family member that has contacted us, get a history, get an assessment of the family and the individual that would be intervened upon, find out if it is in fact appropriate, if it's the right time to do it, and then set up a pre-intervention, make sure that everybody involved is aware what is going to happen, that they're comfortable with it, and what the primary objective is.
And Rosemary, is that something that you would actually be there as well? Like, or do you just give instructions about how to do that?
I always help facilitate the day of the intervention. It's a very intense emotional process for a family, you know, to be left on their own to do that. There's also the chance that, you know, if they're trying to do that on their own, that the addict that's going to be intervened upon would, you know, take control and manipulate, and sometimes, you know, just it would deteriorate.
Right. Do you ever have the addict I mean, so you're doing this as a surprise. I'm just thinking about the things that we see on TV where suddenly the addict walks in the room and, oh my God, there's all these people, what are they here for? So there's usually an element of surprise. Is that necessary?
Well, it is, because, you know, can you imagine inviting someone who has a problem with alcohol or drugs to come, that the whole family wants to talk to you, and we have a professional there?
Yeah.
It just wouldn't fly.
Yeah, they probably already tried to do that on their own somehow.
And families have difficulty with that in the beginning of the process. When I do the training sessions, they're afraid that the person's going to feel betrayed. And I just say, well, you know, I will tell them, don't worry, I coached you to do it this way. And
so you kind of take the flak.
I do.
Yeah. What about you, Carolyn? Do you want to add something to that?
Yes, it has to be a surprise. Otherwise, I've had it where a case didn't work out too well. We were working on arranging an intervention. The family wanted me to try and meet with the addict, substance user, whatever terminology you want to describe the person who would be intervened upon, prior to it, to see if a soft approach would work. And that would probably have been the mother and the father and and the son and me. And the son had perhaps very good instincts, or I'm not quite sure, but he ran when the meeting was supposed to take place. He just ran out of the house, and it fell apart, and there wasn't a future opportunity to arrange anything.
Right. Viewers, if there's anybody out there who's would like to phone in, please, we invite you. I mean, I'm getting some information about interventions, but please think about giving a call in if you have any questions or experience. Does the family ever, get back to you, Carolyn, for a sec, does the family ever say to you, I don't want to do this, can you do it? Can you do the intervention, just you and the person? Just show up as a surprise.
I haven't had exactly that request, but I think that I've definitely had people want to put it more into my hands, and we deal with this at the pre-intervention. So I work with a family counselor and a multidisciplinary team. So we have a medical doctor and nurses involved if necessary, and they're in the sidelines. And then the family counselor and I will discuss the case in advance. And then when we meet with the family, we make sure this is what they want to do. And I leave it up to the family counselor to use her expertise and training at that point, but she doesn't usually attend the intervention.
Okay. Now, both of you mentioned soft and versus hard intervention. So what's the difference? What would one look like versus another?
Well, for example, you might have an older adult that is the person with the problem. And so that usually requires a little bit of a softer intervention.
Right.
So, for example, you know, I guess a year or so ago, I had a son come to me. His mother was the one with the problem. And so after gathering information, we made the decision that it would be best if just he and I met with her. And so we did, and it was successful in getting her to agree to go to treatment.
And then a hard one might be more like a teenager who's resistant kind of thing?
Well, actually, I don't do interventions with adolescents. I leave that to my colleague, Hamish White, who was here last week, because that is a different process. That is a softer. Absolutely. Yeah. So I work with adults, you know, anywhere from 19 or 20 years of age.
Okay. Interesting. Okay. Well, so callers, if there's anybody here who's had an experience with intervention and want to share that, please do. Or if you have questions about it, you know, most of us are just familiar with what we see on TV, and clearly there's more sophistication than that. We'll be right back after the break with more help on Toronto Speaks Addiction. Welcome back to Toronto Speaks Addiction. I'm Dr. Vera Tarman, and joining me today are Rosemary Munro and Carolyn Green. We're discussing interventions and if they're an option for you or a loved one. So during break we were talking a little bit about the process of intervention, hard and soft, and now I'm wondering, who is it that actually makes the call? Who is it that usually wants an intervention? Do you want to start with that, Rosemary?
Sure. Well, usually it's a family member. Very often, if it's a parent, it's one of the siblings that call. Sometimes it's a friend. It's the person in the family that recognizes this can't go on any longer.
Right.
And so it's a phone call as a rule. And I usually spend about 15, maybe 20 minutes on the phone.
Okay.
You know, giving information, gathering information.
Yeah.
And then I set up a consultation meeting with hopefully 3 or 4 people that could be involved. And, you know, they come in for an hour and a half. And that gives me the opportunity to see if the parts are there to do an intervention, and you can ask more about that, I'm sure.
Yeah.
And give them enough information to know, well, you know, we can go for the consultation, there's no obligation.
Yes.
It's just to gather more information, because there's usually other family members who don't want to do this.
Oh, that's interesting. Why would that be the case, besides the addict themselves?
Well, a lot of reasons. One, the shame, denial, and the fear that if they do this, they're going to lose the relationship. And those are all very normal fears that people have.
I would imagine that would be a really big issue. Carolyn, maybe you can address this. The idea that I'm calling on you, I'm actually making an action, and that the fear of a disruption in the relationship. Is that an obstacle?
Well, sure, it's always an obstacle, and that's probably why an intervention is the final step or the final attempt to create change in the relationship. And another reason I might add that I've encountered with some cases is an active addict in the family, and they wouldn't want the intervention to occur because they either instinctively or consciously can see how that's going to bring up the issues with them.
But they're not. You mean they would initiate the intervention?
No, they would not be interested in participating in the intervention.
Oh, right. But they would be resistant.
Exactly.
Yeah, got it.
And then the discussion would have to occur whether or not they would be included in the intervention, and make it clear that they would be a part of the solution.
Because you could even have one without the addict or the drinker or whatever.
The other family member that's the drinker?
Well, then I guess that's a pre-intervention. You have to have the person there to call it an intervention, right?
Yes. Yes.
We actually have a caller on the line. So, Susan, would you like to give us your question or your comment?
I was just phoning just to share an experience, because I did have an intervention.
Oh, you did have an intervention. When was that?
2007.
That's great. Thank you so much for calling in. Do you want to share a little bit about your experience? Was it a surprise?
Yes, it was a surprise. Okay. Rosemary was actually the one that headed the intervention. And yes, it was a surprise. So I remember a friend of mine, it wasn't a friend, he was saying that this was going to happen to me, and I never believed it. But then when I walked into the house, yes, it was a huge surprise.
So you actually got pre-warned that there might be one.
He was suspicious, right?
Oh, okay. It's kind of like a surprise birthday party. Okay, so what happened? So then there you were, you walked in.
And then there's the interventionist, right? And there's your chair, and you sit down in your chair, and your family members read you letters of, basically what the addiction has done in their lives, right?
Now, Susan, let me ask you, were you not, you heard those letters, but you probably heard all that before, right?
Yeah, that's correct.
So what was your reaction when you had this formal thing in your face with stuff that you'd already heard before?
I was angry.
Okay.
So I was angry because 2 of my siblings, they were also active addicts. So for them to, so when they read the letters, I was just like, okay, this is, why are they singling me out, right? I was a single parent of 3 children at that time, so upon reflection, I see the beauty in it, but when I was in it, I was not happy.
So how did you get from the angry place to, you're clearly not angry anymore. Are you actually in recovery right now?
Yes, I am.
Did it work? I guess that would be my question.
Yes, it did.
Okay.
It did.
So how did you get from that angry to it actually working?
I think, well, the thing is, like, for me, I didn't know there was any other solution, right? So, and I was an active alcoholic and addict for 20 years, and I was pretty deep into it. So it came to the point of this was the last chance or last hope for me, and it was through, you know, I got angry in the intervention. I left the intervention. I called my ex. I went and sat with him, which wasn't a happy relationship. And then that's when I always say that's my moment of clarity, is when I came back and I tried to negotiate, of course, because that's what we do. Learn I had no negotiating power, and then I just said, okay, let's go to treatment.
So you actually left the intervention and came back that same night or that same event?
That same day. Yeah.
Okay, and then what actually was proposed for you?
But we had to basically, they already packed a bag for me, and then I was to go with my father, my sister, and my brother-in-law, and we were going to go to care and treatment centers, which was in the United States.
Right. Yeah.
Yeah.
And did you have a choice?
The choice was either I get locked into the house I have now, or I go to treatment, or I go back to my ex, which wasn't a happy relationship to begin with. So the choices were, I had choices, sure, but they really weren't that great choices.
Let me ask you a question. So one of the questions that I asked in the promo was, can you force somebody to get sober? What's your opinion about that? Because you were kind of forced.
I think.
What stopped you from just saying, okay, I'll go, and then the moment you get out, you go back out there and use again?
Well, you see, that's just it. Like, that's exactly what my thinking was. My thinking was, okay, I'm going to go, I'll do this 28-day program, and I'm going to get them off my back, and then I'll go back to doing what I'm doing. It's just, again, it comes down to, for me, or what I believe it comes down to when it's your time, and also how big were your consequences, right? So the more sober I got, because I wasn't sober for at least 15 years, I was always high, right? So the more, I think when you dry the addict out, it gives the time for them to actually start to see things in an honest light, and then see that, okay, maybe we might want to try this.
So Susan, if there was one ingredient that you would say worked, was it the actual skill of the interventionist, or was it the fact that you were in treatment and you had the clean time? What was it that worked for you?
I would say it was a combination of it all. I'm a believer that if you're in it the way I was in it, you need every resource you can absolutely get. Because the interventionist could not have held my family together and had them go actually walk through that process. They wouldn't have been able to do it by themselves. There was no way, right? Because most of my family didn't believe it was going to work, right?
Susan, I really want to thank you for sharing your experience. Do either of you, I've been talking a lot, I'm sorry, do either of you have something that you want to add? We have another caller, but if you have a 30-second blurb about something.
Just thanks, Susan, for calling in. It's so important that people know and understand that this is something that works. And, and you know, you've been sober and clean a long time now, so way to go.
Yeah, really, thank you. Carolyn, did you want to add something?
Yes, thanks for calling in. It's nice to hear the positive outcomes, because they're not all positive, or at least they don't all work out the way we hope they will. That doesn't mean they're not positive. It may mean it is one part on the road to change.
Yeah, like she said, it's something about it was her time. I do want to hear more about that, where it might not work, but we've got Stuart on the line, so let's give him a chance, and then hold that, because I want us to come back to that. Stuart, thank you for calling in, and why don't you give us your question or your commentary?
Well, my pleasure, Vera, and thank you for providing the opportunity to the general public about this issue. It's certainly something about 3.5 years ago I wouldn't have tuned into, nor would I have had an interest in it, because I certainly didn't have any issues. But certainly from my perspective, my life was perfect about 3.5 years ago.
Are you another fellow that's had an intervention experience?
Yes.
Oh, okay.
Yes, okay. I've had personal up close and in my face sort of intervention.
Yeah.
And about, as I say, about 3.5 years ago, I was perfect. There was nothing wrong with my life. It was absolutely going swimmingly. I may have had a bit of a drinking problem at times, but everybody indulged me, and I was a good controlling person, and I could certainly control everything in my life.
What do we call that?
Denial.
Yeah, denial, delusion, you name it. But it was May, the long weekend of May 3 years ago, where and at the time, my wife and I had been separated for about 8 months. My eldest son was not speaking to me. My other daughters were, I think, just kind of annoyed at me most of the time. But other than that, life was fantastic. And I walked into my home that I wasn't living in anymore.
Oh, wow.
To see this person that I'd never seen before, ever sitting in my den with all of the closest people that I love.
Wow.
Sitting there. So it was my children, my estranged wife, my sister, and my nephew I was very close to. And it still to this day, it chokes me up to think that they went to that extreme. I know at the instant, my nanosecond thought was, what the heck have people been doing behind my back, and how dare they?
Yeah.
But that I think was the perpetuation of my delusion.
Yeah.
They proceeded to tell the most beautiful, beautiful, loving stories about their dad and their brother and their wife and their uncle, and then tell me how my drinking and my addiction had so badly affected them.
Well, you know what? That's really interesting. Maybe you can comment on that. I heard you say that they started with how much they appreciated you, and then they moved into. Do you want to Stuart? Just hang on. Do you want to share on that's like the actual process of the intervention, right? Do you want to just share a little bit about what that would look like?
At the pre-intervention, we always have a discussion about this being an act of love.
Yeah.
And perhaps tough love. F. Scott Peck, who wrote The Road Less Traveled, claims that love is a verb or an action. And so what I've seen in all the interventions I've done is a lot of love.
Right.
And I can think of one story in particular where the woman's whole family came together, all of her children, her husband who couldn't even speak because he had his voice box removed in surgery, her sister who flew from Alberta, and her nieces and a family friend, and they all came together and communicated how much they love her and how much they want her back.
So surely that would have an impact, so that when that person's so immediately resistant, you want to pick up on that, Rosemary?
Yeah, so the purpose of the script, that's very carefully planned ahead of time, and it's a very cathartic process for the family when they write these letters. I'm still always in awe of that. So the purpose is, it's a very fine dance we have to do between presenting the reality of the drinking, using behavior and not causing so much shame they want to leave the room. So the letter is there to help, remember the person they were before addiction took over their lives, and to honor that, and then to go on in a very non-judgmental way to talk about their using behavior and how it impacts each person.
Stuart, do you want to pick up a little bit? I don't want to forget about you. So we got a little bit about the first part. So what happened? Was that the piece that made you willing to hear what you weren't listening to before?
Yeah, I think it was a combination of a couple of things. I mean, the only experience I'd had with intervention was the TV show, and I remember watching it with my girls who are all in their late teens, early 20s, and it was almost like a judgmental kind of laughing at that show.
Exactly.
Of these terrible people that couldn't suck it up and get on with their lives. And so I realized instantaneously that this was the TV show. We actually had a bit of a joke about the fact that we should have a camera running right now. And the interventionist steered it, but not overwhelming. I got the sense that she'd been quite well trained, or had trained my family quite well in the process. Even I found this out afterwards. Even the place where everyone was sitting. The person I maybe trusted the most was my sister, and there was no way I was going to leave if my sister was there, because hearing about things afterwards, they were so afraid that I was going to bolt, that I was just going to bolt. And I must admit, for a moment, a nanosecond, again, it went through my head, I've got to get the heck out of here because I know what's coming and I'm not prepared to do this, and I can do it on my own.
But you did stay that evening, and so what happened? What happened?
Well, as I say, they read lovely. They went individually around the circle and absolutely beautiful letters to me about how wonderful I'd been as a father, and in their lives, and then were very clear on the devastation that I had wrought in their lives, and the hurt that I had caused.
But
and
did you end
it
up?
was awful. It was tears. It was emotional, and it was heart wrenching.
Okay.
But it really got the point across that, from love and concern, they were doing this for me. They weren't doing it because they disliked me or hated me. They were doing it because they loved me.
Stuart, did they have like a plan? Like, you've got to go off to doing?
Yes.
And wow, and you went that night? Like, was it really like at that moment?
I did. Yes, it was announced to me
Wow.
in no uncertain terms. Although I guess I'm a free man. I could do anything I wanted. In 5 hours, I was leaving on a plane with my sister
Wow.
to travel to a treatment center in Nanaimo, BC.
Uh-huh.
And I think at the time they told me it was going to be about 4 weeks, but it ended up being 2 months. Not that I would have gone. I would have gone in any event.
That's
I
funny.
think they realized it was a bit headstrong, but they saved my life, quite frankly, in the intervention, in their involvement with my family saved my life. I know that.
So it worked. Like, you went to treatment and then you got clean after that.
Yes, I went to treatment for 2 months.
Okay.
Came home. It was a 12-step program, so I joined AA, and I actually just finished my home group meeting tonight, and I wanted to call in.
Oh, thank you. So, Stuart, let me just ask you one more question, and that is, had you not had the intervention, do you think that's what it was that got you to where you are right now?
Absolutely.
Like, you would not have got this on your own?
I would not have done it on my own.
Yeah.
I could always control everything. There was no way on God's green earth I would do this on my own.
Right.
Looking back on it now, I mean, knowing what I know now, it's easy to say that, but I was too headstrong, I was too delusional, I'm an alcoholic, and I was not prepared to admit it. I'd either be dead, or my life would be my life would be a tragedy, and my family's as well.
Stuart,
I'm convinced of that.
Thank you, Stuart. I so appreciate your sharing your story. I really thank you very much. We have another caller on the line. Adele, would you like to give a question to one of the panelists, or if you have a story you want to share? Go ahead. You're on.
Hi, Vera. Thanks so much.
Hi, Adele.
Hi, Adele.
Do you have a question?
I do.
Go for it.
So I guess the risk of the intervention in general is that you need to give the person who you're having the intervention for a consequence or a bottom line. And my question, I guess, would be for Rosemary, is what happens when the person isn't willing to toe the bottom line? Have you ever had a situation where the family isn't willing to follow through?
Okay.
And how do you handle that?
Thanks, Adele. Go ahead, Rosemary.
Hi, Adele. Let me back up a bit. First of all, when I'm working with the family and preparing them, we do the letters. I have them do the bottom line on a separate page, because I like to give the person the opportunity to say yes first.
You actually write out a bottom line.
Oh, yes, we actually do.
Okay, go ahead.
So, but I like, because sometimes the person will go without having a bottom line. And, that's the ideal way. It helps them save face, and it's easier for the family.
Right.
It's easier for me.
Yeah.
So, but however, when the negotiating goes on for so long, maybe an hour or so, then I have to make the judgment call about when it's time for them to bring out the bottom line.
Which is like the or else.
Yes.
Yes.
Okay. But it's different for each person, each individual.
Yeah.
Now, so your question was, the person says no to the bottom line, right? That's your question. Then what?
Yeah.
Adele?
I'm in a situation now where my ex has relapsed a number of times, and each time he's gone back to live with his parents.
Oh.
And so when you're in a situation like that, how do you go about navigating that situation? Is one time too many, and how do you have a bottom line with someone who's continuing to relapse and you want so badly for them to be well?
Yeah, because I guess the bottom line, they keep evading the bottom line. Yeah, okay. Okay, Rosemary, why don't you answer, but I'd like Carolyn to throw in her sense.
Okay, the bottom line is not a punishment. It's as much for the family. And the way that they determine their bottom line is to look at their enabling behaviors. and that they're no longer going to do that anymore. So if a bottom line might be for a spouse, for example, I'm going to arrange for separation, they have to be really, really ready and prepared to do that.
Okay. Do you want to add something or
Well, the first thing I thought, Adele, would be an intervention would probably only work if the parents were on board. So if that's where he's running back to.
Right, in that case.
So to work with a counselor, invite the parents into maybe a pre-intervention, provide some information about what you see in your relationship that maybe the parents don't see. Parents are afraid they're going to.
Hold on a second. So Adele, is that an option for you? Could you do that?
I don't know. I don't know, but I have addicts in my life constantly, and I see this cycle continuing, right? People putting down a bottom line and then
not
backing away from it, and not in a formal intervention setting, but more in a this is it if this happens again.
Yeah,
and so maybe my real question is, how do you help the loved ones in follow through with the bottom line?
Right, like the parents or so what do you say to that, Carolyn?
Well, that's where I work with the family counselor. And hopefully the family at the pre-intervention or at some stage before the intervention would be willing to continue with their own counseling. And that may ultimately lead to the change that you're hoping for with the substance abuser. But it might take some years. Referring them, especially if finances are an issue and they can't afford counseling. There are 12-step programs for family members that specifically address the enabling, the caretaking, a sickness of their own kind that needs to be treated, and if it's severe, it probably needs some severe professional help, some psychotherapy.
Callers, if you are just about to, you have a question and you want to, please call in. There's time for a call, and good. Now, I want to ask you. So you said you were talking about the spouse, and I would think that just sort of piggybacking on what Carolyn said. They might say, I'm going to divorce you, but that means a life change for them.
Exactly. That's why I spend 6 to 8 hours in preparation with the family. And I, work diligently if it is a spouse, because, obviously they would have the most leverage in a situation like that. And to make sure, that they have some legal advice, first of all, that they have a plan. So you can't just make a statement like that and not have a plan to go along with it. And so you sort of judge whether the person is ready to follow through.
But I would imagine that you can also ferret out all of the various potentials, like I don't have to divorce you, but you have to leave the house. But you can come back if, that sort of thing, right?
Well, each circumstance is different, absolutely.
So Adele, you're still there, right?
Hello?
Adele? Well, I'm just curious because she could see that there were some issues that sounded like it was more complex than just the family, but lots of addicts in the family. So there's probably quite a lot of obstacles. So do you want to elaborate on more stuff that Adele or somebody like that might be in her situation?
Well, sure. The first thing that comes to mind is, for religious reasons, some people would not consider divorce. But they could consider separate living quarters. So if the substance behavior is causing problems for the children or abuse, then you can say you'll have to leave, or I'm going to call the police, or I'm going to follow through. And like Rosemary was saying, get some legal advice before, if there's legal issues, find out what your options are. And so it may not just be this 6 or 8 hour pre-intervention. It may be many weeks or months. I think of one case in particular. The daughter of a woman was consulting with me for about a year, and I kept giving her various options. And the family had attempted their own variations of intervention.
On their own, probably.
Yeah, so I felt very comfortable when she did decide to come for an intervention. I said you could try it on your own if the expense is an issue, and it is an issue. It's quite a few hours invested, but it's a good investment, especially if done well. But it's an investment for the family members because they know that they've tried, and it helps mitigate the guilt.
Yes. Yes.
So
I mean, just think of the guilt of a mom having to then follow through with, I'm not going to pay your rent anymore. I'm not going to send you money. Like, how do you, like, that's the thing that people struggle with.
That's a very good point, Carolyn, that you mentioned, that it doesn't always happen in a 3-week period. That sometimes you have to work with families or part of the family ongoing, you know, for a few months. And of course encourage, you know, the 12-step support of Al-Anon and so forth. And you know, I'm part of a multidisciplinary team, and we have recently started for families a restructuring program, so that
what does that mean?
Well, what that means is that the family comes and works with our family counselor that we have at our office. And if the person's in treatment, then, you know, that's great.
Yes.
But if not, then it prepares them so that maybe then they may see other courses open to them or other choices open to them.
Right.
So there's a lot of support that's needed sometimes. It doesn't always go by the book, right?
right, it's
So,
you mentioned, Carolyn, and I'm sure people would like to know the answer to this. What is the cost of something like this?
well, it varies.
Is it covered even?
It's, to my knowledge, it's not covered. The family counseling part. There are some insurance programs that would cover it, and that requires the Rupert Case Management or whatever company to often pull in all the credentials of the
right, like maybe an EAP of some sort might have something like counseling or social work, and you can kind of work with it that way.
I would like to see some more government funding through Ministry of Health for family members. There doesn't seem to be very much.
So what is the cost?
So I could do an intervention for if all the pieces come together very well. The family is on track. They know what they want. They've probably had some counseling before. They've had family discussions. They're sure that this is what it is. The pre-intervention could be 2, 3, 4 hours with 5, 6, 7 people, and then the intervention 2, 3, 4 hours plus some transportation time to get the person to treatment or withdrawal management. Probably around the $4,000 range.
Okay.
But it's probably going to be more than that, because when you get to the pre-intervention stage, there's lots of questions. I just inform the family members that they deserve to ask all the questions that they need to.
Right.
But that it costs if it's too long.
And is that the same kind of ballpark figure that you're aware of too?
I offer a 3-month package because
like it's a package. Okay.
I do.
Yeah.
Because first of all, you know, when the person goes to treatment, most of the treatment centers, and I have good relationships with a number of different facilities, and they're very skilled at working with someone who comes by an intervention, because it's not easy. And they usually get the client to agree to sign consent for me, so I follow their progress through the treatment program.
Oh, I see.
As well as, you know, work with the family, getting them into this whole concept that it's a recovery program for them, that they have their own recovery. And so it's actually harder sometimes getting family members to, you know, they think as long as they can get him or her to treatment, everything's going to be okay. So that's a process that takes a little time in encouraging them.
And one of the things I'm aware of that Al-Anon really preaches is, or advocates for, is that, you know, where does the family actually keep the process of the addiction alive and well? And I would imagine you have to address that.
I do that up front in all of the training that I do. I do education about addiction as a brain disease, that it's not her fault, it's not his fault. I do all of that to help them reduce their shame about it. as well as, of course, the idea, the concept that, we have to heal the whole family here.
Yeah.
That as a family, you have suffered the most in this situation. And so, to understand your caretaking and your rescuing and your fixing has helped him normalize his life so that he can stay in denial.
Yeah. Do you want to elaborate a little bit on that? Because I think that's worthy of fleshing out.
Well, yeah, I was thinking of all models of addictions treatment are harm reduction. There's the more severe end of complete abstinence, and there's the very liberal end of full-on using, just a little bit less.
Exactly, like the moderate drinking plans. Yeah.
When families are enabling, what they're doing is they're taking away the harm. And if the active addict does not experience harm, why would they change? The other thing is it's very important for them to get into treatment where they can get detoxed, so they're not suffering the acute withdrawal symptoms.
Right.
They get a few good sleeps, a few good meals, and a constant stream of information. They've removed, maybe not completely, but a large component of the disease affecting their thinking and their decision-making process.
Which is kind of part to do with that hitting bottom piece. That I just want to invite callers, if any of this intrigues you, if you've thought about doing an intervention but you're not sure, please give us a call, because we've got the experts here that will tell you what the next steps are. So we're taking away the bite. Yes, but I don't know, do you want to elaborate more, or Rosemary, do you?
I'd like to, you just mentioned the word hit the bottom, because there's still a myth out there that, unless an addict, alcoholic hits bottom, you can't help them.
Right.
And, the reality is that addicts hit many bottoms, but there's always somebody to pick them up, rescue them,
so they're hitting the bottom.
So they have many bottoms.
Yeah.
But it's these loving caregivers
yes.
that prevent them from having the consequence of that.
Yes.
And so they pick them up and rescue and dust them off, and then they go on and they make all kinds of promises, of course.
Yeah.
And I know from my own experience, because I'm in recovery myself a long time now, and I know the manipulation and the self-delusion that goes on. So now I just lost my train.
Well, have either of you actually experienced, well, I don't know about you, but an intervention? You said that you're in recovery. Did you actually experience one?
No, I was one of those fortunate people that just sort of came to one morning.
Yeah.
And, I, years before, had been a member of Al-Anon. And so I knew more than the average bear about addiction.
Yes.
And I used to sit with all my drinking friends and say, she's at this stage, or he's here.
Oh my, yes.
They all
you
had
didn't
a
see
problem,
your stage.
but I was
Yeah,
fine.
yeah.
And so then I came to one morning, one Sunday morning, and I thought, oh my God.
Yeah, so it seems to me like, in a way, that an intervention does two things. It confronts the denial of the addict, and it supports the family who is feeling terribly guilty and shameful.
Absolutely.
Yes.
Yeah.
And it gives them hope for the first time.
Yes,
Vera,
yes.
that there is a solution.
Okay, yes.
And 90% of the time, at least those are my own statistics,
yes.
90% of the time, people go to treatment. And I've been doing this now since about 1993.
Right. Okay, so the intervention will lead to treatment. Now, we have another caller, Anne. Anne, would you like to give us your question to one of the panelists, or give a story, like a commentary? Go ahead.
Sure. I just have a question. I wondered what kind of training you need to be an interventionalist.
Okay, interesting. Do you want to start with that, Carolyn, and then Rosemary take it over from there?
Okay, so I am ICADC, which is the general standard for addictions counselors.
What does that stand for?
And it stands for Internationally Certified Drug and Alcohol Counselor.
Okay.
And I don't have any specific training in interventions except through my experience over the years.
Yeah.
So I've worked with family counselors, and I work at Rupert Case Management on a multidisciplinary team with a medical doctor, 4 nurses, the family counselor that I mentioned, and social workers and other specialists that we can bring in as needed. So a lot of other problems arise when a person gets sober or clean or clean.
Right.
For example, one client I had found out as a result of going to treatment and then following up on healthy self-care and going to her medical doctor, she had COPD.
Okay.
Now, she didn't completely quit drinking. She cut down her drinking substantially, but was able to arrest the progression of the COPD, and she's on oxygen, so it was severe.
Rosemary, do you want to take a add on that? And Anne, hang on the line, please. Go ahead.
Yeah, sure. Well, just briefly, in my own case, I took the training back in the early 1990s. The Johnson Institute from Minneapolis came and did the training. I was already certified as an addiction counselor, like Carolyn mentioned. We have a professional organization that certifies us. So, and then a few years ago, you can't get certified as an interventionist in Canada, actually, which is kind of rare. But I'm a Love First certified clinical interventionist, which I got in the U.S.
So it's clear that intervention is not just something that you say I want to do. There's actually training involved, and backup. There's training in actual addiction medicine as well, or not medicine per se, but addiction counseling, because you have to deal with the addict. Yes.
And Carolyn mentioned an important piece that it's so important to have experience working with families because you spend all that time mostly with the family.
I'll just ask you to hold that thought. We will be right back after the break with more help on Toronto Speaks Addiction. Welcome back to Toronto Speaks Addiction. Today we're discussing and taking your questions on interventions and how they really work. So, Anne, are you still on the line? Okay, that's all right. I just want to make sure that Anne got her. I think we answered your question. So, Carolyn, you mentioned sort of the family dynamics, and I know that Al-Anon addresses this, but why don't you flesh out a little bit the family disease? I think it was maybe you who mentioned that it's a disease that the family is dealing with too, or a mental disorder, a mental delusionary process. That's not just the addict, but the family that might actually be feeding the addiction. Why don't you elaborate a bit more on that model?
Oh, well, sure. My experience in working with other therapists, addictions counselors, family counselors, medical doctors, is that the family disease model in addictions has been widely accepted throughout the world, but in particular in Canada and the U.S. For at least the last 20 years, and perhaps you can confirm that. The family doesn't just necessarily need counseling or help. They have a right to it. They deserve to be helped as much as the substance users. And the family disease model isn't just how one particular family now interacts and family members enabling, but there's the genetic theory that factors in. So it can be generational, can go back to grandparents, great-grandparents. It can be societal or cultural.
You know what, I want to ask you this question, which kind of relates to that, if it's genetic. What about the family member? I'll give this to you, Rosemary. What are you going to, let's say it's the alcoholic, are you going to ask the family, okay, now you can't drink anymore either, and what's the reaction to that?
That's a great question. Because first of all, when we're in the training sessions, preparing and do the letters, I ask each family member or each person, friend, whoever they are involved, part of the team. So I need to know, we need to talk about your use of substance of any kind.
Right.
And the reason it's important for me to know that is I don't want, Mary saying in the intervention, who do you think you are? you drink 2 liters of wine every night.
Like that person who called in, yeah, with your 2. But don't you get pushback by saying, I want to be able to have my beer at night?
Well, not too often.
No.
And of course, the family will also ask that question. Well, what does that mean? We can't have wine with dinner? And so it depends on whether the person is living with the family, whether they're living on their own, coming from family dinner. And I say, you know, for the first year, it's just very considerate. And this is a very individual thing, you know, from one even therapist to another, that it's just considerate. If someone's quitting smoking, you don't bring out your pack of cigarettes when they're sitting in the, in the veranda.
Right.
So all of that,
it's
all
kind
of those
like when
things
the person's
get
on a
covered.
diet and you offer them your latest baked good.
Exactly.
Yeah.
Right. So it's just being considerate, really.
Now, Carolyn, one of the things that you said, and I want to come back to this, or I said I would come back, which was the idea of sometimes these interventions turn bad. And what did you mean by that?
Well, I alluded to it when I mentioned the story about the son of parents that were attempting to do a soft intervention with me, and he got wind of it somehow and just bolted out the back door. And it was the way their house was structured. He was able to sneak out without us even knowing about it until the mother went down to his room, which was in the lower part of the house,
and there he was not.
There was also in that case. Without having the opportunity to do a thorough assessment, but my general impression was that one of the 2 parents were not in full support of the intervention, and were very obviously enabling and quite literally sabotaging, because that wasn't the only attempt.
Do you want to elaborate on that? It sounds like
well,
you
I like
know what
to
she's
say
talking
that
about.
even, that 10% that addicts that don't go to treatment, the intervention still works because it's for the family. It's just as much for the family as it is the person with the problem. And if that family continues and goes into their own recovery, there's a much greater chance that down the road that person will get to treatment.
Is it ever possible that an intervention can actually do harm? It just didn't work. Just like medical interventions, we can actually give meds which cause disastrous side effects that you weren't expecting.
Well, in my own experience of all these years, I can't think of a situation, Vera, where it came to harm.
Yeah, because if nothing else has planted the seed, I guess, eh?
Well,
even if
it gives them choice. It gives the family the choice that, they don't have to suffer from somebody else's disease. It gives them the choice that, they can go to meetings, they can get counseling, they can learn more, they can change their behavior. And for the addict, I mean, it won't be the same again if the family follow through with their bottom line. So,
that's the key, is the following through.
It's a big thing to lose your family. Who do we have in life for most people?
Now, Carolyn, have you ever had an experience where it looked like it worked, the person went to treatment, they were good, but then they relapsed? Can we say that the intervention failed?
Oh, yes. Quite a few of the interventions I've done have resulted in relapse, but relapse is understood to be a normal part of the recovery process.
So it's not a failure.
It's not compulsory, but it is normal.
It's not compulsory.
And I often use that exact word because, some people relapse and don't make it back for a second, third, or fourth attempt. And could result in death. And addiction is a fatal illness.
Now, we've just got about a minute or so left, and I want to give both of you a chance to just wrap up about what you would like the audience to hear about interventions. So, Rosemary, why don't you give a...
Well, I guess my message is, because I'm so passionate about this, and I have had the privilege of working with so many families over the years, that to do nothing is the worst possible thing, because it will not get better. I can guarantee that.
It will not get better.
So at least explore, investigate, learn more about what you're dealing with, because otherwise.
Yes. And Carolyn, do you want to give your 30 seconds or so?
Okay, sure. The whole point of the intervention is to intervene in the progression of the addiction and to reduce the harms that are caused so that it's easier for the person to rebuild their life. So, like Rosemary was saying, do your research, decide, if it's right for you and your family, and the better outcome for all.
I'm going to have to cut you off. Thank you so much, both of you. We are out of time. I'd like to thank both of our guests, Rosemary Munro and Carolyn Green. And I'd like to thank the callers. We'll be back next month with more Toronto Speaks Addiction. Thanks for watching.